Hi everyone, and welcome back to the Raymond Report. I'm Raymond, and I'm here to cut through the confusion and help you out with your personal health insurance problems. Today on the Raymond Report, Big Brother has arrived, and he's alive and well, and right there in your living room. Here's a yes or no question for you. Could your company penalize you for eating a cheeseburger? Well, in fact, if you're overweight and your boss orders you to get on a diet, could your family be penalized for up to $2,800 on your health insurance contributions for refusing to go along with the company's wellness program? Seems unlikely, right? Well, here's what people on the street thought.
It sounds horrifying, but what does that mean, take part? What does that mean? Does that mean that as long as you eat a salad once a day, you're allowed to have a cheeseburger too on the side once a week? I mean, what does that mean, take part? If you jog around the block once a day, are you then allowed to go out and have an ice cream sundae because you're like partly participating? I don't even know what that means. And I don't know how an employer even has the knowledge to make that decision.
That's kind of scary because who's making those decisions? It's probably not going to be doctors or people who have much training. It's just going to be business people.
A lot of it's just going to be a lot of lying. You're just going to eat cheeseburger somewhere else. So unless there's a way to actually enforce it, it's useless.
Well, I hate to tell you this, but if you said there's no way you could be penalized for the effects of what you eat, you'd be wrong. If you're overweight, have high blood pressure, diabetes, or anything where your company doesn't think you're taking proper care of yourself, they can penalize you. So yes, the time has arrived where Big Brother could supersize your insurance contribution for eating a cheeseburger. Now let's take this a step farther. Let's say you get a new job and it's time to go through orientation. We've all gotten used to those drug tests we have to pass before we start work. But here's what could lie ahead. Number 1, take drug tests. 2, supply 4 vials of blood, stool, and urine samples, as well as DNA. Undergo MRI scanning. And 4, report for an HR interview on your personal habits, including smoking, diet, and your hobbies. And if you're applying for family insurance coverage, bring your spouse and children in to do the same. Sounds like a stretch, right? Wrong. Most of this is already legal. So keep in mind, if you have unhealthy habits on the job or at home, it could cost you money. If you're a smoker in some states, they could fire you. And remember, wellness programs are becoming more popular with employers as they try to contain their and your health insurance costs. So if you choose an unhealthy lifestyle, it could cost you. If your company has a wellness program and you don't participate, it will cost you. If you don't get your scheduled mammogram or colonoscopy, it's going to cost you. And yes, that cheeseburger could cost you as well. But keep in mind, your coworkers' poor health and bad habits both hurt them and also raises your premiums. So Big Brother has reasons for keeping an eye on you. Is it wrong? Do the ends justify the means? It's up to you to decide. But I can tell you this, the law allows employers to do this, but it also protects you from being abused. For example, if you are overweight and your employer requires you to lose weight and your doctor says it's unhealthy, you cannot be penalized by your employer. When we come back, I'm going to help you save money on your prescriptions. Stick around.
And I can see how it affects their other employees when their group rates go up because of a few employees, but it seems hard to justify being able to tell your employees what they can and can't do when it's a fairly personal thing.
What you're looking for is some kind of reasoned approach that balances the government's responsibility, the employer's responsibility, and the individual's responsibility. We haven't been smart enough in this country to come up with that kind of a reasoned approach about anything. So it's not surprising that we're sort of wandering in the wilderness trying to find out how to find out a reasoned approach to this. But I don't think any plan should make it any one of those 3 constituents' total responsibility. I do think everybody has a role to play.
Healthcare should be given to everybody in a country where there's supposed to be all this opportunity and people have all this money. You know, I just really believe that people should have healthcare, no matter what it is.
Your Your doctor gives you a prescription for an expensive medication, and your out-of-pocket expenses start to add up. Here's a great way to work with your doctor to bring down those costs. This little item, it's called a pill splitter. It only costs about $5 at most drugstores, but it can cut your drug costs in half. Let's say your doctor puts you on a 30 milligram a day medication, but it's also available in 60 milligram doses. Here's the strange thing. The cost of both the 30 and the 60 milligram is the same. Get the 60 milligram tablet and split it in half. It'll cut your costs in half. Now, not every pill can be split, and you'll want to talk to your doctor before doing this on your own. But this is becoming so popular and important that several insurance companies are making pill splitting mandatory. And it's all for a good reason. Up next, do you have health insurance problems? I'm here to solve them, and the solutions may surprise you. It's time for Hey Eric when we return.
I was sick with the flu, some stomach bug, a few weeks ago, and it made me pretty nervous just because going to the hospital would cost so much money, just to the emergency room to get checked out, make sure it wasn't anything serious. So it makes me very nervous.
Welcome back. It's time for Hey Eric, where we answer your emails and even step in to solve your health insurance problems. Our first email comes from Credit Crazy, who writes, Eric, several years ago, my daughter was rushed to the emergency room. The emergency room physician fees should have been covered by my health insurance, but they didn't pay the claim. Now it's been turned over to a collection agency, and my daughter's credit is so badly damaged that she was charged extra when she applied for auto insurance. What should she do? Well, Credit Crazy, even though this claim was several years old, our investigators managed to dig up all the paperwork and even get senior management from the insurance company involved. We got this claim processed and even contacted the credit bureaus to have your daughter's credit restored. Finally, out-of-network writes, Hey Eric, my wife has a rare medical condition. I've done research and found out that not one physician in my network specializes in treating this disease. We can't afford to pay for the treatment out-of-network. What do we do? Dear out-of-network, I have great news for you. First, we found a doctor who specializes in your wife's condition. Then we contacted your carrier, explained the situation, and they've agreed to cover the fees at no additional cost to you. Good luck. That's it for this episode of the Raymond Report. I'm Eric Raymond, and remember, don't let those health insurance companies or your employer push you around. Get angry. Let us fight back for you. Email us at heyeric@theraymondreport.com. We're here to help. See you next time.